Hi everyone, welcome back to our channel. My name is Tiana McGee, and in this video we'll talk about what I get asked quite often. What skills are actually needed to become a pharmacy technician? A lot of my students would ask me what skill sets they need in order to become a successful pharmacy technician, as well as stand out when it comes to interviewing for those positions. Well, number one, you should be organized. If you're a person who doesn't like to put things in order, strategize on what should come first, what should come next, being a pharmacy technician might be a little difficult for you. One of the responsibilities would be to take care of the inventory. Medications are alphabetized or placed in a category according to their classifications. So you need to retrieve and put back the stock whenever a prescription comes through or whenever you're finished with a certain drug. You also need to have great organizational skills when it comes to the flow of the pharmacy. Think of it like this. Let's say inside of an emergency room, you have patients there who have stomach aches, maybe they have headaches, maybe they have some sort of ill feeling, they might have the flu or something of the sort. Then you have a patient that's wheeled in by the paramedics and they are unconscious. Which one is going to be serviced as soon as possible? The patient who's unconscious. It's the same concept you want to think of inside the pharmacy. You have a patient who comes from the dentist, they have some tooth pain, they may even have some bleeding of the gums. You want to get that patient out as soon as possible versus another patient who comes in to refill a high blood pressure medication. You can place the one who came from the dentist first and the one with the hypertension medication second. Another great skill to have would be multitasking. If you're in a retail setting, you have patients calling on the phone with refills. You also have patients coming in the pharmacy who want new prescriptions filled. You also have patients picking up prescriptions, those in a drive-through. In a hospital, you have multiple orders coming down from every floor of the hospital. The goal is to complete tasks one at a time, but also if something comes in to interrupt your flow, you must be able to handle that as well. Another great skill to have would be paying attention to the details. You would not believe how many prescriptions come through a pharmacy in which the doctor is contacted and asks for clarification, verification, or just plain old, "We have no idea what this prescription says. What are you trying to say?" It's so important to understand what is normal on a prescription and what is not. What looks valid on a prescription and what doesn't. It depends on the type of drug that's being prescribed as well as how often the drug is being prescribed. The goal is to make sure patient care is there. And if there's a question about whether or not the patient is being overdosed, underdosed, given a medication that doesn't line up with their health condition, the pharmacy team is there to get that correct information. Having accuracy is another skill. Matter of fact, it really should be at the top of the list. It's very important and it should be piggybacked off of paying attention to details. When it comes to the medications that a pharmacy has, a lot of them look alike and sound alike. And really there is no room for mistakes. Everything needs to be doubled and triple checked, making sure the calculations are right, there's no overdosing going on or even underdosing, patients are receiving what they're supposed to have, and each time packaging is involved. Time management also plays a role in how you process orders. If you're in a retail setting and you give a patient a certain time of when their order should be ready, you need to do what you have to do to make sure it is ready at that time. Remember, patients trust you. Pharmacy is in the top 3 professions most trusted in the United States. Do what you need to do to have it ready. And if you're not able to have it ready for whatever reason, make sure you're communicating with that patient to tell them why and how you can get it prepared for them. In a hospital, same thing. Think about what orders are coming down from the floors or even coming from the emergency room. Patient comes in with gunshot wounds, stab wounds, the orders are stacked or immediately. That means you have to prepare the orders very quick, fast, in a hurry to get it out to them to administer. Other orders can take a back seat, not put on the shelf permanently, but they can be processed at a slower pace. Depends on what's going on. Now, this skill a lot of people may cringe at, but it is a necessity, and it's having solid math skills. It definitely depends on the type of pharmacy you work in. Some pharmacies use a limited amount of math. Maybe the scope of practice is limited to one sort of type of dispensing, okay? Other pharmacies that have a larger scope of practice, especially when dealing with IV compounding, will have to use different math skills for different things. It really depends on the type of pharmacy you're working in and what is required to do that specific job. And this last skill, you have to really think about it. Think about it before you go into pharmacy. This last skill, think about this. Really marinate on this. This right here is probably the number one skill. This should be at the top of your list. Ready for it? Be a people person. Do not enter the profession of pharmacy if you do not like people. Yes, I said it. I said it just like that. If you are not a people person, if you don't really like or care to be around other people, pharmacy may not be the profession for you. That's because it involves you taking care of the public. It involves you interacting with patients and customers and coworkers. Whether or not you decide to work in a retail setting in which you'll see customers all day, or at a hospital where you won't see any of the patients, but you have a team, a pharmacy personnel team that you're working with day to day. There are many times different duties in the hospital where you would have to go up to a floor and interact with the nurses when you're filling their crash carts and things of that nature. But if you don't like people, I'm so sorry to say, but it's true. This is not the profession for you. You must love to interact with people, or to talk, or at minimum to talk to them, and to talk to them professionally. That's all I have for you today. Thanks so much for watching. Make sure you like and subscribe to our channel, and check out our website at everlearningtc.com. Until next time, take care.